Namaste. Welcome to Socialpost Health Channel viewers. I, Dr. Chava Anjaneyulu, Senior Consultant ENT Surgeon and Chairman for Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center is an all diagnostic and treatment facilities for ear, nose, throat problems, tinnitus, hearing loss and advanced hearing aids are available. Vertigo problem, snoring, nasal allergy, voice problems. We have specialized lasers for ear, nose, throat problems, and most of the surgeries wherever possible we are using lasers to get the best results. Children having breathing problems nowadays more, nasal obstruction, nasal discharge, recurrent cold with fever, sleep disturbance, these problems are increasing. Many children nowadays, when they are starting to go to school, they are having this recurrent cold problems, fever problems, recurrent infections. This is mainly because of the adenoid hypertrophy and inferior turbinate hypertrophy. The main reasons for the hypertrophy and recurrent infections for adenoid and turbinate due to the increased pollution and increased viral infection rate. Nowadays, viral infections are more. Every day we are seeing new patent virus, new viruses are coming, and for new virus we don't have much resistance, so that will spread very fastly and infect more patients, and in children they don't have that much immunity, so they will cause the problem. Viral infections initially affect the nasal mucosa, turbinate mucosa and adenoids. Simultaneously pollution is increasing, especially in urban population, urban areas, mainly due to automobile pollution with the carbon particles and constructions nearby. Most of the times around our homes construction is going on. These dust particles and carbon particles continuously goes into the nose, cause inflammation of the turbinate mucosa and adenoid mucosa, cause hypertrophy, increased secretions. So, this hypertrophy and increased secretions further aggravate accumulation of the viral particles and pollutants into the nose and cause further problems. Along with the adenoid hypertrophy, many children now are having ear pains, recurrent ear pain. Especially some children, they are having severe pain in the early morning hours. This is due to otitis media because infection spread from the adenoid through the eustachian tube into the middle ear and cause inflammation, accumulation of fluid and cause hearing issues, ear pain and dullness because continuous infections, breathing problem, patient, the children is not active. They are not active in sports, they are not active in education, they are not active in communication, they are always dull, try to sleep in daytime, they don't like to go to outside and play. Although this is a simple problem, but nowadays this is becoming more because of pollution and viral infections. Many parents, they say this small child adenoid is persistently giving trouble, how to treat, how to make child healthy. This is very simple. Nowadays patient requiring surgery. Lot of parents, they have apprehension regarding any complications, and many people say is the child resistance will come down with adenoidectomy. No, the real issue is if the patient is in continuous infection, their immunity will become less, they are weak and they are not active. If you remove adenoid, if you do turbinate reduction, patient airway will become better, good. No viral infections further or less infections, the intensity of infection is less. With this, patient children becomes healthy, happy, they actively participate in sports, education and communications. So no worry at all if child is having persistent adenoid hypertrophy, turbinate hypertrophy, recurrent infections, simply we do the adenoidectomy to coagulate. It is very simple procedure, safe procedure, no complications. We do the surgery under endoscopy guidance, accurately we remove the adenoid and patient symptoms will improve and patient growth physically become better. And the complication is almost nil with the adenoidectomy procedure and blood loss is very minimal, even you can say few drops. So if your children is having problems with recurrent cold, adenoid, turbinate hypertrophy, tonsil, contact Asian ENT Care Center. They will examine your child and diagnose with X-rays and nasal endoscopy, confirm the diagnosis, they do the surgery if need, adenidectomy properly and your children become better and healthy and their growth, physical activity, sports activity will improve. For further updates, subscribe Social Post Health channel.